Hello and thank you for tuning into my channel. My name is Henzi Tanrin Sawyer and I'm providing you this video so that you know how I provide clinical supervision. Now, this video is strictly for those who are qualified therapists. If you're looking for a new supervisor, or you're a psychotherapist, or you're a psychologist and you want a new clinical supervisor who will help you with your caseload, you've tuned into the right channel. You're welcome. My name is Henzi and I run my own private practice, and I'm also a qualified clinical supervisor. I provide clinical supervision using the seven-eyed model, and I'm going to be talking about that today, just in case you want to, maybe you're thinking of changing your clinical supervisor. You just need a different perspective. I work integratively using psychodynamic model, also using the TA model. I use CBT, I use the person-centered model and other models, family systems, creative therapy. I work with adults, couples, groups, young people, and hopefully I can help you using the approach that I use to help you look for what it is that you want in terms of your caseloads. All right. So in terms of providing the support that you need, what I normally would ask is, if you're qualified, sometimes people ask me, well, Henzi, do you work with student counselors? I don't really work with student counselors just because I don't have the time to give reports, and I don't have the time to be able to, write reports. I'm busy in my practice, so I wouldn't usually see student counselors, but I do see you once you're qualified and you don't require any kind of report, then I'm able to see you. Now, in terms of the seven-eyed model, I'm just gonna go through it quickly of what you'll be expecting in the session during clinical supervision. So I usually, when the client comes, I usually give you the space to talk about your client. So as we are sitting, I'm asking you about your client because I want to get a picture of who your client is. I think it's very important that I get to know who your client is. So it's really asking you about your client and what your client is saying. We focus on the client, and that will help me in terms of asking you to relate the behavior. So when a client comes into the session, what is it you're observing about your client? I would need description of your client, how the client appears in the session, what you notice about the client. So it's just giving me an overview as we use that first eye model to focus on your client. And also, I also focus on the intervention. So I'll be looking at what intervention you use with your client. How are you using that intervention with your client? What theory you're using with the client? And is the client accepting that? Is the client responding to the approach that you're using? Because if the client is not responding, we will look at why the client is not responding, and if there are any way that you could use something else or include. Now, some of my supervisees will say to me, Henzi, but I'm person-centered. I also encourage them to use a little bit of CBT, because sometimes clients, when they offload, they want something to go away with from the session. They did need a little bit of tool for them to say, okay, I've come to this session, but I need to know what to do now. So I do encourage a little bit of CBT if they can implement that in their session with their clients. And we look at anything that you could have done differently with your client. And then we begin to focus on the client supervisee relationship. So what is your relationship with your client? So when your client comes into the session, what is it you're feeling with the client? So I'm looking at your unconscious processes. I'm looking at any kind of transference that may be going between you and the client. What you're experiencing about your client when they come into the session. Is the client invoking any feelings in you? When they talk about the things that they're talking about, what is it you're feeling? You as the professional, you as the therapist, you as the counselor, what is it that you're feeling when your client is speaking to you? So I'm looking for any kind of transference and counter transference in your relationship and how you respond to that in the session. Also, I am looking for, in terms of focusing on yourself, you as the supervisee, I'm looking for your emotional responses, how it shows up in the session, any kind of internal processes that, that you might be sensing in the session. And I'm also looking at you in the session, what may be your emotional responses that you don't see, but then I can pick it up in our supervision session, looking at that. All right. So also in terms of my relationship with you as a clinical supervisor and you as a supervisee, I'll be looking at if we are working together. We're looking at the ethical framework that you're using, and if you're working safely and ethically with your client. We'll be looking at any ethical issues such as boundaries, evaluations, your parallel processes that come up in the session, and how you're finding our working relationship. That's something that I always look at in terms of. And then usually I will say to my supervisors what I sense in the session. So me giving you my view of what I think might be going on for your client and what I'm sensing I am feeling about the client and the supervisee in the session as you're presenting. And I also like to look at the wider family of the client. So when you present your client, does the client have a wider family apart from themselves? Are they talking about what's their background? What about their family? What about their relationships and friends? Are they talking about that? And are you exploring that? We also look at that. And we also look at what the relationship is between myself and the supervisee and the supervisee and their client. So it's looking at that whole relationship and me also thinking about, okay, what I presume the client might be feeling, giving my own perception of what I think might be going on, and how also that client, as you're discussing it, what I'm feeling about the client, and looking at my own internal processes and how the story might be affecting me also. Usually I do say to clients, to supervisee, when they come into the session and they start to talk about their clients, when I spot things there that I feel that they need to take to therapy, I would say to them, I just suggest book a therapy session with your therapist and see, if it's something personal that is showing up in the session, you can address it there. So that is how I use the 7-eyed clinical supervision model to work with the professionals who are looking for clinical supervision. Now I work by the hour. I work by the hour in terms of 1 hour. So some people will say, do you do an hour and a half? No, I don't provide an hour and a half supervision. So I provide an hour supervision because it gives me enough time to work with you and also see my clients. So if you want to book, okay, before I forget, let me just mention, so I see supervisors online. I use Zoom as a platform. I can see you face to face or by telephone. So another thing that I'll be looking for is your self-care. How are you taking care of yourself? Are you resting so that you don't get burnout? Because that also can affect how you work with your clients. So we look at self-care. It's very important that I find out how you as a therapist, you are working with your client, also taking care of yourself, because that's very important. Okay, so that's something we also look at in the session. I hope this video gives you enough information. I know people call me and say, Henzi, I need a chat, but I think this video will give you enough information. If you want further information of how I work, please visit my channel. The information is there on the description. Visit my website and also look at my channel, my YouTube channel, and see. That will give you an idea of how I work so that you can book a session with me. Okay, I hope that's enough information. You take care, and I'll see you in the therapy room. Bye.